ring in or ring out Friday. Good morning,
Good
Barb.
morning,
How are you?
Sharon.
Good
I'm
to see
doing
you on
well.
this side of the camera.
A little different
I
here.
usually see her over there, and
Running
now
the
she's
show.
right next to me, which is pretty wonderful. So I
Just to
hope
tell
you'll,
you,
I hope
I'm
you'll do it
diverse.
again. That's right. Well, thanks so much for joining me.
Thank
It's
you.
a great
Thanks for having
treat.
us.
And we have a great guest this
We
morning.
do. Today we have with us Dr. Sidney Cohen. And Dr. Cohen is a licensed full-time practice for over 30 years in Cherry Hill. And he's written 2 self-help books. One is your Self-Sabotaging Inner Bully
And I have it right here.
and Inner Blocks to Losing Weight. Very
looks-
topical subject.
This looks interesting.
People
too.
always need that help there.
Mhm.
Idea of why these topics and how your practice and all of what you can inform everyone about.
First, I'm glad to be here.
You're
I
welcome.
appreciate having me on.
Thanks for being on.
Okay. Well, self-sabotage. I think anyone and everyone is capable of that at one time or another.
Oh, it's that negative loop that goes
Right.
on in your
Yes,
head.
yes. And Dr. Cohen himself is certainly capable of
Of
this.
course, you're
Of
human.
course, and you're probably more in tune to that, and it makes it a little more harder to deal with, right?
Right.
Well, actually, in the introduction to my book, one of the things I make clear is I do a little personal disclosure.
Right.
Is the words that I like to use is I wrote the book on the inner bully.
Oh,
Right.
So I get that
Great.
nice little double meaning
Uh-huh.
about that.
Okay.
The idea of self-sabotage basically is that there's 2 ways people sabotage themselves, even though they consciously don't realize or intend necessarily to do that.
Okay.
So there's self-sabotage in terms of your thoughts,
Mm-hmm.
the kinds of negative,
Sure.
obsessive, self-defeating, self-critical thoughts.
Mhm.
There's also certainly self-sabotage in terms of your actions, things that you do that undermine ways that you're trying to get what you want.
Like bad habits.
Bad habits. And context can be relationships, context can be on the job or in school, and context can be in terms of specific goals. One of those specific goals being the subject of weight loss, where, needless to say, there's an awful lot of sabotaging that goes on
Right.
during the course. In the book on weight loss, there's a term that I use throughout this book called the inner bully,
Mm-hmm.
which is also the general term I use in terms of the self-sabotage
Okay.
idea. So inner bully is a metaphor that's used to describe a negative force inside of all of us. And the purpose of that negative force in our subconscious is to get us to sabotage ourselves. So in the example of weight loss, one of the terms I use in this book and part of how people sabotage themselves is in terms of this notion I call addiction to self-rebellion.
Oh, that's
Mm.
interesting.
Yeah. So
Never heard that.
So, like, if they're doing it purposely without realizing, it's like a subconscious.
Yes.
Okay.
And in 3 main contexts. So when I talk about addiction to self-rebellion, there's 3 ways in terms of trying to lose weight you can rebel. Eating more than you should, eating things you shouldn't, and not exercising when you said that you were going to.
And knowing all of these things too.
Yes.
You know this, but you're doing it
Anyway,
kind of purposely, kind of.
I have a question though.
Sure.
Is any of this fear-based at all?
ultimately,
Personal fear?
yes. One of the blocks that I talk about in this book, it starts to get a little bit of a layer down beside just the rebellion piece, is there are underlying fears and anxieties
Right.
that can sabotage people no matter how determined they are to lose weight. So, for example, whether a person consciously realizes it or not, if you lose weight, the good part is you're going to feel better.
Healthy.
Self-esteem, self-confidence, and all of that.
Right.
Appearance?
Appearance, all the above.
Right.
However, if there are certain unresolved issues you have,
course.
okay, relationship issues, whether you're going to make certain transitions in
Right.
life, if you stay overweight and you don't feel as self-confident, you don't have to face your
You have
fear.
to
Right.
make those changes.
Of
It's
making
like a
those
force
changes.
protection. It's a force
Absolutely.
protection.
Wow.
How about that?
It's pretty heavy.
Yeah. And it is common. And the other thing I want to be sure to mention in terms of this whole notion of sabotage and inner blocks, my whole concept is not about replacing diet programs that are out there, not replacing anything.
Okay.
This is not a diet and exercise program.
Okay.
What I'm about and what this is all about is how to increase the chance that whatever program you choose, whether it's Weight Watchers, whether it's Jenny Craig, whatever the program, this is an adjunct. Because if you look at your blocks and you can address them and hopefully break them down, the goal is really to get yourself more on track and not let the sabotage take control.
Okay.
So you're getting more on track with yourself on an inner level. So these programs that you're possibly using to help you lose weight or whatever it is you're trying to do with your health will actually become more reinforced and work better for you.
And more effective
Yeah.
programs, because even if someone's doing those one Weight Watchers, Jenny Craig's, but they have this block, they're still stuck. So
That's
you
right.
kind of help, you kind of join and marry with those programs. Those programs still can work. You're not the 10 steps of how to throw away chocolate, but it's
Right.
helping them with the psychology behind it.
That's
That
absolutely
those
right.
other ones don't do.
That's exactly
They're giving you the
what-
diet and the regiment. You're giving them what's going on
The
inside
reason
to
to
have.
do
Yes.
it,
Right.
really.
Yes.
you know.
Wonderful ideas. And this was evolved out of your practice, hearing this over and over again, I'm sure, from
Over and over again.
patients, yes.
Yes. The piece I want to just take that one more step. Most people, in my experience, don't want to look at those blocks.
Mm-hmm.
They
Oh,
keep
sure.
it on pretty much, you know, black and white level.
Right.
Here's the
Pilot here.
program, right? And in the process, when the roller coaster ride kicks in, because that's of course what most people experience, the ups and downs. You
Right.
start to, you know, lose 10 pounds, maybe 15, depending, of course, how much you want to lose, and then something kicks in inside, which arbitrarily I call the inner bully. And
Okay.
at that point, this so-called inner bully deep down is saying something along the line. Where do you think you're going? I don't want you getting a success out of this. You have a history of not being successful,
Right.
so it's time to start rebelling. It's time again to start eating more than you should, things you shouldn't, or
Right.
not exercising. Hence, of course, at that point, what happens? The sabotage sets in. Little by little, the weight is regained, especially under stress.
Right.
If something very stressful happens in a person's life, in anything, of course, we're all vulnerable
Sure.
to sabotaging and going off track under stress.
Right. So that really does involve the ego as well.
Oh, yeah.
Really. Your
Yeah.
ego is feeding you all of this.
Funny word, feeding,
Yeah.
Charlene. You're saying
It
feeding,
is.
which is
Well, we're
true.
talking about weight
I know,
loss,
but
so-
I just picked up on
No,
what you
of course.
said. It's very true.
Sorry.
You know?
But
Pun
it
kind
is-
of intended,
Yeah, it really is your ego that is driving most of this, correct?
Yeah, ego is one term that can be used for it. It's interesting because to me the term ego actually means a couple of different things.
Okay.
So the ego notion it was Sigmund Freud's notion that the ego is doing things that are realistic, you know, maintaining reality contact and so forth. But there's also, of course, a way to think of the ego, which is being egotistical.
Or I
Okay.
want more and more and more. The ego wants more of this, so I'm going to give it to my ego because it makes me feel better.
Yes.
Right?
Where, on the other hand, what the ego can then be up against is if you start to feel guilty. And then the superego kicks in.
Oh,
So
gosh.
you got the superego acting on the ego.
So the egos are fighting.
Right.
Yeah, they're,
All trying to keep you under
Yeah.
suppression.
Yes.
Keep you oppressed.
yes.
So you have to just get rid of your ego, I guess, to move forward and go through this?
Do you want to get under control the part of the ego that is
Yes.
steering the sabotage? Because the good part of the ego, so to speak, again, is making rational, good decisions. Although there's still one more piece to this, and that's Freud's id.
Okay.
The id piece, that is, the, you know, the core
Right.
basic drives, amongst other
Yes.
things, to eat.
Right.
Yeah.
So there's this interplay of all three parts.
Okay.
So to maintain self-control over a prolonged period and really reach your goal, all those forces being in play, it's a lot, of course, easier said than done. So people read the book. So let's say that's a starting point to get some of the basic concepts clear.
Right.
But what's so important for people to do the one-on-one work is that there are books like this. They give information, people can relate to some of it. But in the end, as I'm sure you both can imagine, issues are individual.
Of course.
So one person's issue may be relationship oriented and it may not be as big a deal
Right.
for someone
Sure.
else.
Right.
Different strokes for different folks.
Right.
So
And I'm
if
sure
you-
that vacillates too.
Sure.
Sometimes, you know, they're okay, then things happen in their life and it throws that binge eating or guilt eating or, you know, boredom eating, all kind of
Right.
reasons why we do.
I hate myself eating.
Yes.
Right, all
you
that
know.
stuff, you know.
Yes, yeah. And again, stress can be certainly as much a
I'm
factor
sure that's
as
a
any.
big factor.
Very
Right.
much
Because
so.
there's stress related to all of those things we just covered,
Right.
Yes.
mainly, you know.
Yes.
So do you have a take-home worksheet or something, work that they do at home on themselves before they meet with you to accompany your book?
Not so much. I think that's a very good idea, actually.
Oh,
There you go,
Um,
Shirley.
what generally I do before a patient actually comes in is I tell them I have a website. And I tell them to go on the website. It's optional, but I encourage to go on the website
Okay.
so they can begin to get some of the concepts clear.
Right.
So I have a tab on my website that talks about the inner bully.
Okay.
So people walk into my office with a little bit of an understanding of that. I also have both of my books summarized on the website.
right.
Okay.
That's
So a little bit of feel for that also.
Dr. Cohen, why don't you tell the audience what your website is? And if anyone just tuned in, we're here with Dr. Sidney Cohen. He wrote 2 books as well as he's been in practice for psychology for 25 years. Why don't you share with them what your website is so they can find that information?
Okay, great. My website is www. And it's my whole name, Sidney J. Cohen, PhD.com.
Okay.
Let's talk about the inner blocks to losing weight, and it's subtitled "While You Lose the Battle More Than the Weight."
Wow, that's a
And
heavy
that's
one.
really more of a mental state here, right?
Yeah. The inner blocks goes with the notion of the inner bully. So the inner bully is what steers us inside to some of those blocks we just mentioned.
Mm-hmm.
The addiction to rebellion block,
Right.
the anxiety block. But there's also a few more than that.
Right.
For example, subtly, not in all cases, but sometimes, one of the blocks can be, I call it the loyalty block.
Loyalty.
Yes, a kind of a subtle subconscious thing.
Mm-hmm.
This one in particular is if you grew up in a home in which food and eating was central to family
Italian.
life.
It's my household.
Such as
I'm Italian.
Such as Italians.
You have to eat.
Right, it's part of your
Right,
life.
mange,
It's
mange.
your life, right.
Right.
If you don't feel good, you eat. If you feel bad, you eat.
Right. There's always food, and if you don't
Right.
eat, you're in trouble.
Right, right. Speaking of eating, Dr. Cohen, if I could interrupt you, I'm getting a signal to take a
Yeah.
commercial break, and
Okay.
maybe it's a food sponsor.
Okay.
So if we
So-
can come back and we'll get into the inner bully on weight loss after our sponsor.
The Salvation Army Croc Center is here, helping families achieve their full potential with fitness facilities, indoor competition and play pools, performing arts theater, educational programs, and fun for all ages on our 24-acre campus in the Kramer Hill section of Camden. Book now for birthday parties and corporate events. Monthly memberships start at $25 for a household of 4. The Ray and Joan Kroc Core Community Center in Camden, where potential meets opportunity.
My name is Karonda Jones. I'm the owner of Kitty Academy of Mount Laurel, New Jersey. The 4 pillars of life essentials are developmentally appropriate curriculum, technology, health and fitness, and character education.
They give great attention to each child, and my kids are happy at the end of the day. Academically, exposing them to the state curriculum early, he's getting the exposure with the alphabet and the numbers and reading and writing, so I'm really confident in him going to the next level.
This year they did little pictures with the kids, and they made like popsicle sticks and made their own frames, and you know, it had a little picture. They were holding a picture that said, "I love you, Daddy," and literally that morning I melted. Everybody's friends here. Yeah, it's not like he comes home every day crying about the bully. It's like everyone's buddies.
The worst part about Kitty Academy is trying to get my kids to come home at the end of the day. They have so much fun.
For independent living for seniors age 62 and over, People Inc. offers safe, maintenance-free apartments across Western New York. The affordable rent is income-based. For more information, call People Inc. Senior Living at 817-9090.
And we're back from our break. I'm Charlene Chamberlain, and you're watching and listening to Morning Coffee. I'm here with my guest host, Barbara Freire, and Dr. Sidney Cohen. And right before the break, we were talking about some of the strategies to break. But Dr. Cohen also mentioned another word, and that was
Deserve.
deserve. So
Deserve.
he's going to fill us in on how that plays into all of this inner bully and mind chatter and negativity when you're trying to lose weight.
It's actually a tricky issue. If you ask somebody, what do you want?
Mm-hmm.
In a sense, it's a no-brainer. We know what we want in life. We want to be happy. We want to get what we want in the different contexts in our life. Many, many years ago, a patient of mine suddenly, after saying what they want, kind of took a little hesitation. They said, "But I'm not sure that's what I deserve."
Ooh. Oh.
And it was very striking to me.
Yeah.
And we talked a little more about it, and this is something all these years later now I make pretty much a standard part of my work. Point being, you can consciously say, I know I want, let's say staying with weight loss for the moment, I know that I want to lose weight. I
Right.
know that I want to feel better about myself. But this inner bully piece can say, well, you don't really deserve to do that
Wow.
because there are things you've done in the past
Oh.
that contribute to guilt and a sense that, in a sense, not worthy.
Right.
So that piece can kick in at some point with 5 pounds, 15 pounds, whatever it may be, and when that plateauing starts to occur, one of the ways I interpret that is, you're in a bully stepping in, saying you don't deserve it, get back to
Kick
where
them
you
out.
were.
Right.
Yeah.
So
Sure.
if you are experiencing a lot of this inner sabotaging for weight, for losing weight, if that's your main,
Mhm.
problem, wouldn't that inner bullying or that sabotaging be happening in other areas of your life and other things that you were trying to achieve as well?
Absolutely.
Right? It just doesn't affect that one part of your life. It would be everything.
That's correct, and can be across the board. So, for example, let's take a situation in the workplace. You have a job, you can have a good job. However, if the inner bully is kicking in, you don't really deserve to succeed at it because of things you've done in the past.
Right.
So
I don't deserve it.
I don't deserve it, and then that can get manifested in things like you start being late for work. You're not getting your deadlines met.
Right.
In other words, you're getting yourself in hot water potentially, even though you continue to say, I really like this job, I really want it.
Right.
But inner bully, kind of a tug of war, kicks in and says, but you don't really deserve it, and your inner bully, will prove you don't deserve it by steering you to sabotage yourself.
So it's not just related to the food. It can manifest into everything else in your life. What a shame.
Virtually everything.
Yeah.
That's correct.
That's a shame.
I think that's why everyone needs to see Dr. Cohen.
And read his books. There's
Yes.
2 books.
Well, sometimes Dr. Cohen needs to see Dr. Cohen.
Well,
But that's
you
a whole
know,
other
Dr.
matter.
Cohen, I appreciate you saying that because it's very
Yeah.
true. I mean,
Yeah.
you know what? I've gone to therapists in my therapist in my life for many reasons, you know, grief and especially. But I don't think there's anything harmful, or I don't think it makes someone weak to say that they need assistance. I think it shows someone is stronger
I
by
totally agree with
recognizing
you.
I need assistance. You know, if you don't feel well, you go to the doctor for your toe or your abdomen
So
or
if
whatever.
you mentally don't
So-
feel well,
Right. If
why
you
not take
mentally
care of that?
you need to get assistance, I think it takes a stronger person to say that.
I need help.
And then look what happens. We have all these people popping out of the closets with issues because they never, and killing people
And they've
because
stuffed
they
it for
never,
so long.
exactly, they suppress all their issues. They're walking around on the planet without getting assistance from someone like you. And
Or they're overly medicated, which is
right,
kind
which
of
is
That's a
another
whole-
issue
whole
too.
issue by itself.
Okay.
You know, one of the things piggybacking right off that, there's still a lot of stigmas, even though a huge segment of the population, we all know, does go to therapy.
Right.
But there's still enough of a stigma that means I'm weak, it means I'm not
Right.
crazy, and all of that.
Absolutely.
I make very clear to my patients in the first session that my perspective on them being here is 2 things, and that's courage and self-respect, which I don't think could be more the antithesis
Right.
of the stereotype of
Right.
weak. It takes courage, it takes strength to work at these issues
Right.
Yes.
because they can be very challenging issues.
Exactly. Exactly. Just like with a marriage. I mean, it's one thing to just let the marriage fall apart as opposed to saying we need help, let's go get
Let's go
help.
work on it.
Yes.
So who is the stronger person? I think the people that go and get the help
I agree.
rather than
Yeah.
the people that just let their marriage fall apart.
Right,
Yes.
or their health.
Yes.
Exactly.
Yes.
Well, a lot of times it's if the me's wrong, the we's wrong. So
That's right.
that kind of goes all hand in hand. I always say that. you know.
Yeah. And in that situation, each individual partner, just staying with the context of relationships for the moment, one partner can say, I really want this to work. The other partner can say, I want it to work, but one of those partners could deep down have this inner bully saying,
Sure.
no, you don't deserve it to work.
Right.
So that partner may have that stronger inner bully,
Right.
could be the one to sabotage things.
Sure.
Absolutely.
Well, it's the old thing. It takes 2, no matter what. You can't have a solo relationship.
Yes.
So with
Right.
anything in your life, you know,
Yeah.
relationships or work relationships, it's all about a team. So.
All right.
Along those lines, I'm in the social dance scene, and one of my friends said something many years ago. It was psychologically oriented. Said the old it takes 2 to tango,
Right.
but it takes both to also get off the dance floor.
Yeah.
Mm,
I'm a dancer
That's
too, so I get
interesting.
it.
That's very
Yeah.
interesting. That is true.
And if I may mention, there is one other context that I deal a lot with self-sabotage, and that's addiction.
Yes, I was going to bring that up.
Yep, addiction most certainly
That's
is an area.
probably one of the strongest, I would think.
It is.
Probably before food, close to it.
Looking at compulsive eating, though, almost has addiction, so it is
Right.
sort of, actually, I tell patients, if let's say your addiction is substance related, or your addiction is
alcohol,
gambling
yeah.
related, the one thing about those type of addictions that you would think could almost make them slightly easier, although still a big challenge, is you don't have to drink, you don't have to use drugs, you don't have to gamble, but you have to
To
eat.
eat. Oh, my
To
heavens, yeah.
survive, Yeah.
Yes, so that really is for people who think, oh, just stay on a diet, oh, just exercise.
Right.
No, you have to eat, and eating is one of life's simple pleasures.
Yes.
So people need to realize who think it's not that big a deal to lose weight. On the contrary,
Right.
I think it's as difficult as a compulsion or addiction as any
How
because
about
you
that?
got to do it.
How about that? Dr. Cohen, we can go on for hours about this topic, and it's a very interesting topic and affects a lot of people.
Yes.
Unfortunately, we only have so much time on morning coffee.
I
Right.
understand.
So if you can tell the audience how to read your books, your website again, in case anyone just tuned in, we're here with Dr. Sidney Cohen, private practice for 25 years. and if you want to tell the audience how they find you and how they can meet with you.
Great, I'd appreciate that. Both of my books are on Amazon and on Kindle, so they're available there. My private practice is in Cherry Hill, New Jersey, and you can call my number in my office, which is 856-428-1685, and give me a call, and if you want to talk about possibly setting up an appointment, what kind of issues you have, we'll talk.
Well, thank you so much for being on Morning Coffee. It was great to meet you. We hope to have you back again.
It's great to
Thank you. Thank you both.
Thank you.
This was great.
We'll be right